All right, welcome. This is your publication skills. And look who decides to walk in late. No, I'm just kidding. You're fine. Um, see, she was smart. She came in the back door. Genius. Yeah, so welcome. This is your publication skills and medical research course. This actually used to be two courses. There used to be a publication skill, or I'm sorry, a research methodology course that was in the winter semester. We took a little bit of mercy on you all because the new winter was so tough anyway, and kind of combine it into this course here. So this will be a little bit quicker, but it should be a pretty good one, kind of a good introduction into medical research and medical writing that will eventually culminate into your GP1, and then eventually you'll do a GP2 and 3. When I say GP, anyone know what I'm talking about? Graduate project, right? So in order to get your master's, like, you need to do sort of a thesis sort of project here, and we have 3 of them. And basically that just means you need to have some sort of deliverable, right? And so in this case here for GP1, it's going to be a 10-page research paper, at least 10-page, which some of you may be like, holy cow, that's a lot of pages. Some of you may be like, it's not so bad. It's really not so bad overall. And then GP2 and 3, probably one of those will be your EOR presentations when you're on rotations. You'll come back and you'll do a presentation, say, on differentiating this disease from this disease, or top 5 drugs in emergency medicine, something like that, right? Something along those lines. And then GP3 is typically something a little kind of up to you, right? Maybe a patient education pamphlet, maybe multiple choice questions, whatever. We have a lot of time to think about those sorts of things, though. But I do want to focus on the GP1, okay? And so just to kind of give you a brief overview of the course and kind of what we're going to be looking at, what sort of deliverables we're going to be looking for. Let's look at the syllabus first. Everyone has seen that, correct? Everyone's poured over it. They have all the details on it, right? Well, if this is the first time you're seeing it, that's okay too, right? We're going to go over it. And so basically what I want to focus on is going to be, in particular, the modules we're going to be covering. So these are the topics we'll be going through. Now note the course is going to be a little bit different than what we've done previously. Before, it was just the sage on a stage, me just lecturing at you for 2 hours at a time, sometimes 4 if we were being particularly mean. But this time, this is mainly going to be hybrid, right? So instead of having a 2-hour-long video to watch on a particular subject, it's going to be much more bite-sized. So you're going to see several videos that may be posted up for a week talking about several topics, right? So for instance, this first week, you'll see a topic, a video where I go over the whole research paper process, right? And so it's about 17 minutes long, right? So we're talking about bite size, maybe 5 to 20 minutes long, probably on the outside. And then we'll have some sort of deliverable at the end of each week, right? So whether it be a quiz covering the stuff we talked about that week, whether it be an actual submission of, say, your reference list, whatever the case may be, there's something you're going to be turning in every week in order to make sure you guys are being engaged, because it is mostly online. We want to make sure you're actually doing the work, okay? To go along with that, you'll see that the Canvas course, you have to complete all the items before to let you go on to the next week, right? So that means you have to make your submissions and all of that prior to letting you go on to the next week. That is to try and to make sure you guys are staying engaged and actually keeping up with the work, and not just saving, the 10-page paper till like the night before, which I'm sure some of you might be excellent at cramming and being able to produce something workable in a day. But I don't want that. I don't want you to have to do that. I don't want that kind of undue stress to be put on you. Anyway, so in terms of assessments, I just want to show you here what everything is going to be based off of. Notice the quizzes are not counting towards your grade. They're really just going to be meant to test your assessment of, or to assess your understanding of the topics we talked about. So when I cover like a brief stats review, right? Remember stats? We talked about biostats, like p-values and all that kind of stuff. I know most of those memories are repressed, but we're going to have a short video to kind of refresh you a little bit, and you're going to have a quiz you can take on it. And guess what? It's okay if you fail it, because you have multiple attempts, right? The main point is to make sure you're being engaged and you're really kind of getting the point, okay? So this quiz is not meant to be punitive. It's just to assess your engagement. Anyways, you're going to find here several assignments that will make up your grade. You're going to have your research proposal, your reference list, your lit evaluation, a peer review assignment, which we'll talk about in a minute, the draft paper, and then you'll have a proposal where you're going to be saying what you plan to do for your GP2 and 3. Now, is any of that binding? Not necessarily, so don't worry too much about it. I just want to have an idea that you guys are at least thinking about this sort of thing. And so that'll be 100% of your grade there, okay? Everyone with me so far? Okay, so let's talk about the paper, what it's supposed to be. Basically, what you're going to find here is that we're doing research, right? And when I say medical research, there's several different varieties we're going to run into, and I'll talk about that in a brief video. But when we talked about research before, we talked about a lot of human research, we talked about animal research and things like that. Now, are any of you going to be doing actual research on people? Highly unlikely, right? Because one, it's a complicated process. We have to do things like go through the IRB. If you're not familiar with the IRB, I'll have a video on that. We have to go through approval processes. You have to go through informed consent. We don't need to do any of that. We don't have time for that, right? What we're going to be doing is a little bit sort of a less involved sort of form of research where we're going to be pouring through the data that's out there that's already been collected by someone else and trying to pull it together to answer a clinical question, right? So you guys will be coming up with a question during this week and going to be turning that in for your research proposal. Actually, your first assignment is going to be due Friday by midnight. And so that proposal is going to be basically saying, well, I want to answer this question. So I'm going to use my example for what I did for research when I was in my fellowship as kind of the touch point there. And you'll see that in a lot of the videos. So coral snakes, right? My question was, well, what's the best way to manage patients with coral snakes? Should we give everyone antivenom? Should we withhold antivenom? That was the question. We didn't know the answers to that. So part of what I did was actually go through the primary literature and find out, okay, well, what have people done in the past? What are the outcomes, et cetera? And you're pulling disparate pieces of information together to try to come up with an answer. Now, are you going to come up with a definitive answer and you're going to publish this to JAMA and they're going to be like, wow, you really solved hypertension? No, right? But again, you're going to find that this is going to be at least useful for you to learn this skill of going through the literature, finding answers quickly. Because when a patient comes up and they're like, hey, I really hear that ingesting pennies is good for detoxing my body of chemicals, you're going to be like, well, that sounds ridiculous, but let me at least look it up and you can know where to find that information to disprove whatever it happens to be, or to prove maybe a good thing, right? So, first off, we're going to have our research proposal that'll be due this week, and it's going to be just essentially saying, here's what I think my question is, here's what the scope of the problem is, here's how I think, here's what I want to answer, here's my hypothesis, here's how it's actually going to affect my profession as a PA. There's a video on that, so you'll kind of watch through that and just see kind of what we're talking about. And again, I give you an example one to walk through, some comments and whatnot. So that'll be the first thing we're going to do there. Next week, you're going to turn in a reference list. Now again, do you just want to go to Wikipedia and pull a URL off of there? No, that is not acceptable. I expect you to actually do well-cited research here and pulling primary literature. When I say primary literature, anyone know what I mean? It's coming from a peer-reviewed journal, right? So if you pull something from JAMA, Journal of the American Medical Association, that's a peer-reviewed journal. That's a high-quality source. You're probably not going to be pulling from JAMA so much, but it could be from smaller journals, but they need to be peer-reviewed. What does peer-reviewed mean? That someone else who's an expert in the topic you're talking about actually goes through it and will say, well, I think this article is good, it's bad, here's the things you should change, and then that's part of that submission process. Again, we'll talk about that later. But this needs to be peer-reviewed research, right? So again, I don't want you to go pull off of facebook.com/autism causes or vaccine causes autism's Facebook page, right? Like that's probably not going to be a great source, right? You want something that's going to be peer-reviewed, something from an actual journal there, right? Now, again, if you want to have a research article, research paper that argues that, go for it, right? But I want to have actual scientific data to support what you're doing there, okay? So anyway, so that's going to be part of the reference list. We have changed this a little bit to where you're going to be doing 15 references at a minimum. You'll probably go beyond that, I imagine. And then 5 of them need to be at least within the past 5 years. Okay, that's to make sure you're getting the most up-to-date information in regards to what's being done out there in terms of research. Okay. Next up, you're going to be doing the literature review. So this is where you're going to actually take one of your peer-reviewed articles, one of the recent ones, and go through it. And if anyone recalls EpiBio, remember the journal club sessions we did there? It's going to be very similar to that. You're going to answer the same questions, and in fact, it's the same rubric essentially. So I want you to take one of those papers and actually critically go through and evaluate, okay, what are my outcomes here? What are the inclusion, exclusion criteria? What are the different things? What are the outcomes? Does it make sense? Does it not make sense, etc.? And you're going to be doing this anyway to all of your articles, but I at least want to see you do it formally for at least one of those articles. That's going to be one assignment due. And then all the while you're still writing your paper, right? You're still coming up with those 10 pages at least, probably maybe more in a lot of cases there. And then you're going to be able to turn that in, right? So you're going to turn a copy of that into Canvas. Then you're going to turn a copy of that into your peer reviewer. The peer reviewer has already been assigned randomly, I will say, unless you had paid me beforehand. No one did, so everyone is randomly assigned. Again, I apologize if it's your bitter enemy, if it's your best friend, whatever. It just was random, okay? Chaos is a ladder, as they say. So basically what you're going to do is you're going to turn that paper into Canvas. You're going to email that paper to your peer reviewer, and then they are going to review that. They'll have a week to go through that and actually go through. And you guys are familiar with track changes in Word. I'll have a video on that too. That is a very useful tool when you're editing papers for other people. So basically what you're going to do is actually go through and edit the paper, right? You're going to be able to make suggestions, you're going to make comments, you're going to be making all these things to say, like, here's what I think you can do to improve your paper. Again, what is the goal here is to provide constructive criticism. So you can't just say, hey, I think this paper is terrible, and you should feel bad for writing it. Not super constructive, right? This is not like your reviews of your professors, right? This needs to be something where they can actually improve upon it. So you can say, well, I don't think your argument here is very well supported. Perhaps pull another reference to try to support this. Or I think that you misinterpreted this stats here. I think what it's actually saying is X, Y, and Z. That is substantive or substantive constructive criticism. That's what we're looking for there. And then, so once you do that, the peer reviewer will then submit that back to Canvas so I can see what you did, and you're going to send that back to the reviewer or to the actual author. They're going to then have 2 weeks, and then you're going to submit your final draft paper of the graduate project 1. Okay. So again, it's a little bit quick in terms of overall, because I think it's August 2nd. I think is the due date there. Basically, going to turn that in. It should be pretty close to the final product, right? It should at least be content complete. What you're going to be doing though in your fall semester for while you're on rotations is putting the polish on it, making it something you really think is really of high quality, and then you're going to turn that in during the fall semester, and that'll be your final GP1. Again, this is something where if it's good enough, I think we can probably publish some of these things, right? So again, if you write something that you think is really high quality, you find a journal that you think might be a good candidate for your paper, we can talk about that. We can definitely go through it and either find you a faculty advisor, or I can do it, and we can talk about having that paper published potentially. So again, this is a really good opportunity to bolster your CV if you have a publication already. It's a fantastic opportunity, okay? So any ideas or any thoughts, any concerns, questions so far? Again, I'll have videos on pretty much all of this stuff, kind of going through this in more detail, so I don't want to belabor the point too much here. Any thoughts so far, though? Anyone have an idea for what they might want to do for research? We can talk about it briefly and talk about how some things in terms of scope and resources and things like that. Yes, sir.
I wanted to maybe see if there's a link between autoimmune disease like type 1 diabetes and other autoimmune diseases.
Okay. Now, why are you interested in that topic? That is a very good illustrative point there, right? And I'll say this in one of the videos, but basically you want something you're going to be interested in, right? So again, if you're just like, I don't know, maybe I'll just do it on, I don't know, scabies. Like, we don't have any particular interest in scabies unless maybe you had a really bad case as a kid or something. I don't know. Unless you have a really particular interest in it, like, you're going to get bored pretty quick looking through this stuff. But if you have a personal connection to it, either yourself or a family member, or you know someone who had, say if you're really interested in the opioid overdose or opioid crisis because, I had an uncle that died from opioid overdose, right? That's something personal. That's something that's going to keep you interested. So again, that's a very good point right off the bat there, right? So your research question is basically going to be like, well, is there a link between having one autoimmune disease to having multiple autoimmune diseases, okay? And so what you're going to do as a jumping off point is you're going to start to do some of that primary research, right? And so some of the things you want to focus on are, one, you want to make sure that the answer isn't already crystal clear, right? You don't want to go and just say like, well, yeah, there's a guideline that says specifically this is how you're going to do this in every single case. That's too clear cut, right? It's too black and white, and that's not what we're looking for. We want something with some ambiguity to it to say, well, okay, well, what are the unknowns here? What do we not know? What is some of the research, maybe the new research, kind of looking at to say, well, this is what we think is happening now. You also don't want to pick something that is so broad that there's a gazillion articles that are out there that you're never going to be able to get through it all, right? So again, if there's 1,000,001 papers that are all, looking at this and no one really has a good clear answer, that might be difficult in our time frame to really pull that together to get a good paper. On the other hand, though, if you were to say go very, very specific, so you're just looking at, say, for instance, type 1 diabetes and, say, other autoimmune diseases. If you try to go so specific, well, what's the link between type 1 diabetes and, say, lupus, right? That may be so specific that it's difficult in order to find enough papers to really flesh that out to get your reference list that's fully there, okay? So you want to make sure you kind of get what I talk about as the Goldilocks zone. You don't want it to be too broad, not too narrow. You want to be just right, okay? And that may take a little bit of work. And again, I want to be available to you guys. You can come and talk to me. We can kind of come up with some ideas. Okay, well, I may think this is too broad, maybe too narrow, and we'll find something in the middle there, okay? So that's a great topic already, right? And so again, what do you think your hypothesis would be in that situation? Good, yeah. So again, that's your hypothesis. The null would be that there's no link whatsoever, right? You're just saying that there's no, it's just random. Maybe you just got really unlucky in life, right? That would be the null hypothesis. However, you have a hunch, knowing your medical knowledge now. You say, well, I think there's probably a link there, right? That's your hypothesis. And so you'd be going through the research. It's like, okay, well, what do we know about this topic, right? So you can go through and again, you can use things like textbooks, you can use things like UpToDate to help you kind of get the background information, but you really need to get into that peer-reviewed primary literature to get more details on specifically, okay, what's the research that's done out there? Is there a large population study where they went through type 1 diabetics and then they looked to see what other, the incidence of other autoimmune conditions is, right? That is, and again, I don't want to give your whole project there, but those are things you might try to look for in order to try to, get the references in order to form your arguments, etc. Okay. Any other ideas for research? Yes, ma'am. Okay, so Hashimoto's and thyroid cancer, right? So very similar, right? So I say, well, is there a link? Okay, well, that's your hypothesis. So you presume that there probably is one, right? Null hypothesis meaning there's no link. Now, going to your project, how do you think this might affect your profession as a PA? Like, how do you think knowing this information will affect your profession? Yeah, so if you have a patient who comes in with Hashimoto's, that diagnosis, you're like, oh, well, wait a second, I'm a little keyed into this now. Maybe I should be looking into possible thyroid cancer, right? If you catch that earlier, obviously cancer is more treatable the earlier you catch it, right? So that's a very good point. So again, kind of bring it back into, well, how is this actually going to affect my profession? How are other people who are PAs going to be able to do their job better based off the stuff that I'm doing here, right? Now, again, am I expecting anyone to set the world on fire and completely change medicine? No, it's probably not going to happen, but I expect you to edify yourselves and to learn how to find information quickly, efficiently from really good sources, right? That's really the big thing. This is, going to come up. Because again, I get these questions all the time, right? They come up where, a doc is ordering something really crazy for a patient. I'm like, well, why in the heck are we doing this? And they're just like, oh, it's because of this disease state. If I'm not sure what that even is, I need to edify myself, right? I need to go through and actually educate myself and go through and find those articles quickly to be able to synthesize something where I'm like, okay, well, now I'm confident I can deal with this, right? I know what the proper drug therapy is going to be. I know what the proper whatever, okay? So just some ideas, right? And again, there are no bad research ideas. There may be unviable ideas. That's okay. That is all part of the process, and we can go back to the drawing board, so to speak, in order to come up with something that's going to work for every one of you. Now, when you submit your research proposal, I will look at it over the weekend. As soon as you have a grade for that, that means that you have approval and that you can carry on with getting your references and all that sort of thing. All right, you can go into the next assignments. I will probably provide some comments saying like, hey, I think you may want to focus on this. You may consider doing this, X, Y, and Z. Again, take that with a grain of salt, if you will. But if I say, hey, I don't think this is going to work, right? We need to probably go back to the drawing board and we'll come up with something new. That's okay too, right? Now, what if you want to change your mind a couple weeks later? Or if you're just like, I think this whole thing between Hashimoto's and thyroid cancer, there's just nothing there. I can't find anything about it. That's okay too, right? You can go back and say, well, I couldn't find anything, but now I'm really interested in this other topic. You need to get approval from me before you go making any changes, right? Because again, I don't want you to get, 2 weeks away from actual submission of your paper and it'd be like, well, it's just not working, right? So reach out early if you have any questions. It's always going to be preferable to trying to figure something out the night before, okay? Any other questions so far? Anything at all? What do you guys think about this whole process? I really want you to be, I want your feedback about this whole process because this is pretty new to me too. I've never done like a fully online course like this where I'm actually having all these different assignments and things like that, and there's no test to it, right? Again, it's all based on producing these deliverables here. So I want your feedback. If you think it's awful, whatever, I got a new webcam, so you'll see my little face there on these videos. That might be really awful if you're like, please don't. Just don't. That's okay too, right? My mom always said that I had a face for radio. She said I had a voice for the newspaper, but regardless, something I want some feedback on, right? Well, I did get partway through the first video and I noticed there's like a bug flying around and they actually lands on my shoulder at one point. And I was like, this is super awkward. The bug no longer exists, in case you're curious, but you'll see him on one of the videos. But anyway, so that's kind of the process here. So that's kind of what we're going to be doing. Again, I want you to be able to feel free to come by and talk to me if you want to email me, text me, if you want to Skype me, whatever the case may be. I want to make sure that I'm available to you guys so that way you can get your ideas voiced out if you want to. You don't have to come by and talk to me if you already have a very crystal clear idea of what you want to do. That's totally fine. So feel free to carry on. But I'll see you during that research proposal submission and I'll say like, okay, well, I think this might be good, it might be bad, whatever the case may be. Okay. Trying to think of anything else. So you kind of see the roadmap here. I haven't posted this, but this is just kind of a general idea of how things are going to flow for the course here. So let me just kind of zoom in on that a little bit. So you're going to see basically like there'll be a series of videos that'll be posted under each week. Again, you will have to complete all of these at least by clicking onto them. Again, I can't tell if you actually watch the video or not. I would suggest you do watch the videos because I think they're going to be helpful to you. But if not, you can just click through them, and then that's kind of it, right? So again, that's unfortunately one thing I cannot monitor is actually if you're watching or not. But there'll be these different videos here that will give you some ideas about how to do certain things. Some of it may be more technical information about where to find research. Some of it may be things like how to do track changes. If you've never done it before, you may not know how to. And again, if you have suggestions for videos, if you're like, I don't know how to do this, and I'm pretty sure most other people don't either, let me know, and I can make a quick video on that, right? There's no problem whatsoever. I don't want to try to adapt this to where it's something that really works for you, and then can work for future classes as well, okay? And again, if there's no specific assignment that's going to be due for that particular week, I'll probably have a quiz. Again, that's going to be multiple attempts that are allowed, so you can go back through and say you kind of bombed the stats review. That's okay. Kind of go back through and kind of review the information again and make sure you kind of have a good understanding, because again, a big part of what you're doing here is reviewing the literature and being able to make sense of those stats, right? So if you see a p-value or if you see a confidence interval, I want you to feel confident that you can interpret that and actually make heads and tails of what they're trying to say, okay? Let me think of anything else here. I'll have a whole thing about grammar review, about writing medical literature. I saw people in the past that said, well, I think that blah, 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 blah. It's like, well, you don't use I statements in medical literature, right? You don't really talk that way. But if you don't know that, then you don't know that, right? So this is where I'm trying to kind of key in on that to see what kind of writing style is appropriate here. We'll look at things like, IE versus EG. Does anyone know the difference when you're writing? A lot of people use it incorrectly. There's a very funny comic I'll post up there. You can find out the difference. IE just means in other words. So if I said, I'm going to go to the store later, i.e. Walmart, because they have the best prices, that would be a useful case of that. Or EG is basically going to mean for example. You can say like, well, I'm going to go to somewhere this afternoon, for example, e.g. to the store, right? So again, there's different cases for use, and again, a lot of people screw them up. Affect and effect, to, and to, there, and there. I want to make sure you guys are writing effectively and appropriately, because again, if you write something out on the medical chart and you write their lupus was out of control, and you write THEY''RE, you're going to look silly, and so I don't want you to look silly. I want to say, well, at least you had a little bit of grammar review from Dr. Wood. Let's see, anything else that I can think of in terms of this? So again, your topic, choosing the topics will be the most important point of this week. Review those videos, see what you think, and then get that submission in. I'll grade it over the weekend, and you should be good to go from there, right? So I'm going to put some comments there. You can just make sure if you don't see the next module pop up, it's probably because you didn't complete all of the assignments. So again, this would be something where you're going to actually have to go through and make sure you kind of click off of everything before you can move on to the next one. I'll have week 2 published here pretty soon as well for you go-getters out there that really want to get through and get everything done there. Also notice I put up a few of example articles. This is actually from the class a year ahead of you. I got their permission to post their graduate projects, and so again, I think these are good because they are varying topics to give you some ideas of what you might be looking at, what you could be looking at, and just different ways to kind of skin the same cat, essentially, right? So you'll notice here that their formatting might be a little bit different. They were using APA formatting that year. I'm using AMA formatting, so it'll be a little different. I'll put up some style guides and stuff for that. I think citation is really important to make sure you get that done effectively. And actually, most of the formatting I'm going to be going with is going to be based off of JAPA, because I figure that's at least one relevant article, one relevant journal to your purposes as being PA students, and so that's what I'm going with. Again, every journal has a little bit different style, so you'll learn how to deal with that, and I'll have a video on that later on. But again, the most important thing you're going to be looking at is going to be this grading rubric. So I want to make sure you kind of are familiar with this to know what things you're going to be looking for, things you're going to be graded on. So again, having a title page, having table of contents, etc. These are things that are easy to forget about. You take off, and that's easy points off. Okay, so I don't want you to do that. I want to make sure you get all the points you're earning by making sure you include everything on there. Again, I'm not going to count off for style things. So if I say, well, I disagree with you, I'm not going to count off for that unless it's really blatantly wrong or you misinterpreted something. But if you forget to have, say, I forgot to include an abstract, well, that's 10 points off right there, right? So again, I want to make sure that everyone goes by the rubric, just make sure everything is there, and you're going to be fine for the most part in terms of grades. Okay. Again, I don't really care about the grades so much. I care about you getting the experience of actually going through, evaluating the literature, and coming up with an actual research idea and process. Okay. Any other questions or anything? Nothing at all. Any other research ideas? Someone might be like, well, I don't know if this is a good idea or not.
I was looking at a study of ketamine treating PTSD, so not therapy.
Mm-hmm.
But I guess I was gonna come talk to you later because it could go really broad or it could go
Mhm.
really narrow. I'm just having trouble trying to figure out what's the best way to not make it too broad or too narrow because ketamine seems to be treating all sorts of mental disorders like
Mhm.
bipolar, major depression,
Mhm.
PTSD. So that's the part that I'm having kind of trouble with.
Yeah, so that's a really good question there. So let's just start up a new document here. I just want to kind of put my thoughts into. Get a new document here. Apparently, I don't know how to use Microsoft Word at all. Okay, so let's say here. So you're kind of wondering. So you're saying, okay, well, ketamine for PTSD, right? So there's several different ways you can kind of tackle that topic, right? So again, basically what you can look at as well. I could go broad in a few different ways. So for instance, you're like, well, I want to look at different therapies for PTSD, right? So then you can get into things like, well, let's talk about ketamine, let's talk about dimethyltryptamine, let's talk about things like, different behavioral therapies, right? So you can look at a lot of different things kind of going towards the treatment of PTSD, right? That's one way to broaden it out if you were, say, having a hard time finding enough information about ketamine specifically for PTSD. So if you didn't have enough information, or you do it the other way. You could say, well, okay, well, I know ketamine is really interesting because it has all the different properties and they're using it for all these different things. Well, if you didn't have enough information for ketamine for PTSD, broaden that out. So let's say ketamine for treatment-resistant depression and PTSD, or ketamine for bipolar disorder and something else. Okay, so by trying to re-gear it a little bit, you don't have to look at everything, right? Because again, you're going to get drowned in the amount of information that's out there. But by refocusing a little bit, say I only want to do ketamine for PTSD, bipolar, and treatment-resistant depression, right? By focusing on just those three, you can make it a little bit more manageable. That might even be too much for, say, a 10-page paper, right? So you'll get a feel for it by going through and actually doing the PubMed searches, actually going through and determining, okay, well, how much research is actually out there, and you'll be able to kind of retail that a little bit, okay? Those are little things you may not need necessary approval from me, but certainly any kind of whole idea changes, I would definitely kind of reach out to me just to see if I think it's a good idea or not. That's a very good point, right? So there's a few different ways you can tackle that same situation, either broadening out on one end from the drug standpoint or a different therapy standpoint, or focus on the actual disease state you're going to be focusing on there, right? What else? Any other ideas? Yes, sir.
I was thinking about the increased morbidity and mortality of preoperative anemia or bloodless like cardiac surgery.
Mm-hmm.
How the treatment options prior to surgery to handle that.
Okay, so you said preoperative anemia and its effects on morbidity, mortality, and cardiac surgery,
Yeah.
right? So let me just write that up. Pre-op anemia and see effects. Again, it's not affect, but it's effects on M and cardiac surgery, right?
Or bloodless surgery.
Bloodless surgery, okay. Just bloodless. Okay. You getting that right?
Yeah.
Yep. So looking at this, we can see that, okay, well, that sounds pretty specific, right? You may find, and again, I don't know the research, right, on that particular topic, right? So again, I don't know everything that's out there about everything, unfortunately. Most of you probably know this by now. But, if you talk about toxicology, I kind of know what's out there, right? Because that's what I keep up on. That's what I'm, most familiar with. Pediatrics, I keep up on because that's what I do from day to day. This is something I may not know a ton about. However, that's why I'm going to rely on you actually doing the research and be like, well, I'm not really finding a ton of papers about this specific case here. But again, think about things you could look at. So what are some different therapies to try to decrease that morbidity and mortality? What have been tried? What has been maybe ineffective, what has been effective. Those are different things you can compare and contrast to come up with, well, what do I think is the best way to try to prevent morbidity and mortality in this particular type of surgery, right? Or you could look at, say, one particular type of therapy, I don't know, maybe giving EPO beforehand, prior to surgery, and seeing how that affects different types of outcomes on different surgeries, right? So maybe not just cardiac, but maybe looking at, say, ortho, or maybe looking at different things like that, right? So there's different ways you can kind of refocus it's the same idea essentially, but you're just refocusing a little bit to try to make sure that you're not, one, getting overwhelmed with the amount of information that's out there, and you're also getting enough information to there's enough meat on the bones essentially to write a really good paper. Any other ideas? Is it helpful to kind of compare and contrast other people's ideas? Because it might kind of send the light bulb off in your head. David.
So given that half people with sleep apnea develop AFib,
Mm-hmm.
I was saying that should newly diagnosed sleep apnea patients be fitted with a loop recorder to diagnose the possible AFib earlier and prevent worse, like prevent discovering you have AFib through having a TIA or some kind of clot?
Yeah, so try to identify the AFib sooner rather than later when they have some possibly debilitating outcome from that. Yeah. So that would be something where potentially you want to look at, say, like large population studies where they say, well, okay, well, what's the actual incidence? Like, how often does this actually occur? You say about 50% that go on to have that. Okay, well, has anyone done anything like that? Is it cost effective to even look at these patients, to put everyone on a monitor to see if they're going to develop AFib, right? So yeah, you can definitely look at that and say, okay, well, who's the right kind of person that should be monitored, right? Because maybe it's not everyone with sleep apnea, but maybe it's going to be someone with sleep apnea and something else, right? Maybe they're older, maybe they, have some other kind of comorbidity that would predispose them to being at risk, right? That would be one thing you can try to look at. See, who's the right kind of patient for that? That'd be one thing I could think of. Again, these are just ideas off the top of my head, but you may also look at other things like, well, is there any prevention, right? Is there any way to prevent those people who have OSA from developing AFib, right? You may look at particular types of treatment or things like that. So that could be one avenue you could kind of focus on. And again, just because you talk about it here doesn't mean you can't talk about it with me later on. Well, most of you will do some of the research, preliminary research. You're like, I'm not really sure about this. That's when you want to reach out and see if kind of get another opinion on if you think it's viable or not. Right? Angela.
So I'm just kind of curious because I had shoulder surgery when I was like 15,
Mhm.
and then it failed, and so I got it later, like in my 20s, and my doctor said the reason why was because I was too young when I got my first surgery.
Mhm.
So I'm like interested in looking into like the success or failure rate of torn labrum repairs in teens.
Okay, perfect. Yeah, so that's a really good one too. Again, you may find, okay, well, is there enough information here to actually fill out a 10-page paper, right? There probably is, I would imagine, but you can look at things like outcomes of, what does age have an effect on the outcomes of this particular type of surgery, or what are some things just in general that lead to more failures of labrum surgeries, right? And in particular, you can focus on the pediatric aspect, like, well, what age is it okay to get that, right? Is 15 too young? Is it too old? Is 12? Like, who knows? But you can go through and look at different pieces of the literature to try to pull that together to be like, well, in this study, they looked at this number of patients here, and they found that everyone that was under 15, they had a 60% failure rate versus people that were, say, 18 and above had, 20%, right? You can make those comparisons together to be like, okay, well, what do I think is the best time for someone to get this done, right? And that's huge because that can affect if you're, counseling a patient, be like, well, I think you might be too young for this. I think the rates of failure are too high. And again, you may not come with a definitive answer, and that's totally okay, because very often you're not going to be finding definitive answers for these things. But you at least want to come up with what do you think is the best option, what do you think is your best guess based on the literature that's there, right? Because you want to make an informed decision. That's part of the evidence-based medicine, right? You're practicing medicine based off the evidence that you found previously, right? So that could be a good one. Anyone else want to bounce their ideas in the public forum? Yes, ma'am.
So I was thinking of do like pediatric fall prevention strategies lessen the rates of risk fractures in children?
Okay. Yeah, so with that one, you could be, so again, you want to look at different strategies to try to prevent falls in that population, or?
Yeah, it just seems to be like where people, when we're children, we're taught how to play like basketball, soccer, but we're not taught how to fall appropriately. So how people have implemented that in other places and how has that helped? Because I've had a personal experience with that. So, and it's worked pretty positively. So I just want to see if you'll review that too.
Yeah, so it's interesting because you could look at more epidemiologic studies to say like, well, look at this one place where we implemented this new education to see what the differences in risk fractures were afterwards, right? Sometimes you can look at pre-post studies to get an idea for what kind of outcomes you're going to see with that. You can compare and contrast different strategies. Maybe in Europe they do something different than we do here in the U.S. and you can compare and contrast that from that standpoint, right? The sports they play in Europe might be a little bit different. Maybe that has an impact on something over here, right? So playing a lot more soccer or something versus say football. I don't know, right? Again, a lot of times you're going to be coming in with these ideas and I'll be like, I've never heard of that in my entire life, but we can at least speak intelligently about what type of research to look for, ways to try to kind of focus the idea to get just the right amount of stuff out there for you, right? Any other ideas? This is good. I haven't heard any ones that are like I'm just like this is bad. I wouldn't say that anyway, but anyone? Okay, so does everyone have a pretty good handle on what's expected of you? So again, by Friday at midnight, so again, I don't want you to be out the club and then all of a sudden be like, oh no, I got to go turn in that research proposal. That is too late. You should be doing that hopefully beforehand. But come up with an idea, answer those questions. Again, this is not absolutely locking you down to your final topic, right? You can change it later on. I just want to see that you're at least thinking about it. You come up with something. Then the reference list is going to be due. Then we'll talk about the literature evaluation, all that good stuff, right? All along the way, you're looking at these videos. You're going to be having maybe a couple of quizzes here and there just to refresh you on some of these topics. Again, this is going to be sort of a low stress sort of class, I think, for a lot of you, unless writing is just like something you just absolutely hate. Then it might be a bit of a high stress class, but this is something where I want to keep you engaged week to week and keep you doing something, so that way you're not thinking about this like literally the last minute, be like, oh no, I got to finish that paper. It should be done well before then. Okay. Any other questions or anything? Fantastic. So I have a little bit extra time. I'll let you guys go probably sometime soon, but interesting stories in terms of stuff I've seen lately. So I was on call over Memorial Day weekend. It was a very interesting weekend to be on call because it was pretty warm, and the snakes were out. Snakes were awake, they were out, and they were biting people. I had 3 rattlesnake bites during that time. I had like a 2-year-old, I had an 11-year-old, and then I had one that was interesting because the doc called me up and said it was a 30-some-odd-year-old female. And I said, well, that's odd. Why is that odd? It's an older female. You're like, that seems very strange. Normally when that happens, it's typically like they're outside, they're gardening or something, and they're reaching, back behind a bush and they get bit. This was not the case. This person picked up a snake off the ground, which they thought was some sort of like ball python or something, I guess, and they put it into a little bag that they had. And then later on, when they reached into the bag, they found out it was not a ball python, it was a pygmy rattlesnake. And so they ended up developing some, anyone remember what the kind of primary toxicity of rattlesnakes are? That's the coral snakes, right? Yeah. Coagulopathy and a lot of tissue damage, a lot of swelling, tissue necrosis, right? So again, this person got a bit on the hand, was having significant swellings going up past the wrist. We decided to give Crofab, the anti-venom base, off of that. I did have one coral snake bite. Coral snake bites are really tough because, again, a lot of times patients will present asymptomatic, but we can't just let them go because patients can have delayed neurotoxicity, right? And the worst thing I'm worried about is going to be that diaphragmatic paralysis leading to intubation. This guy came in, the doc was like, hey, this guy came in with a coral snake bite. He looks pretty good. He's been here for a couple hours. I want to go ahead and send him home. And I'm like, whoa, wait a second. So I want to get some more information. They said that they had to pull the snake off of the patient. Now, if you remember coral snakes, do they have those big hypodermic needles for things? No, they're all rear mounted. They have to chew on the patient before they actually get the venom in the patient, into them. So they said, they had to pull it off. It's usually a bad sign. It usually means there's a higher risk for having actual envenomation. So that one, I was like, you got to admit this guy to the ICU because that's the place where they can do the most frequent neuro checks to see if he starts to develop any paresthesias, diplopia, dysarthria, anything like that, right? So again, that doc was not very happy with me, but that was not a necessary admission, but it's one of those things where you're doing it based off of, best patient care, right? And then I had a really good venlafaxine overdose. Does anyone remember what venlafaxine, the type of drug that is? It's an SNRI, right? So what would you expect to see from an SNRI overdose, you think? Or seizures? Actually, this patient did have a seizure, right? So this is something where they were taking, they had really bad anxiety, depression, and so over the course of several days, they were taking additional doses of venlafaxine. What do you think it did to their anxiety? All that extra norepinephrine? Does that usually make you nice and chill? Nope, it was making the anxiety worse. They kept taking more and more and more, and eventually they ended up taking all of 80 in about 3 days or so. Presented with seizures, how do you treat that? Give some Ativan, right? Give benzodiazepines to try to calm down those neurons, to try to hyperpolarize them to keep them from firing off. That was great. What else are you going to monitor for in a type of patient like that? You could look for serotonin syndrome, absolutely, right? What does that include? Hyperthermia, increased clonus, especially in the lower limbs, altered mental stats, which this patient definitely had. So again, those are things you're going to be looking for a patient like that. He's very tachycardic. He's like up in the 140s to 150s because all that extra norepinephrine that was there in the synapses. He also, and again, something you always want to make sure you check is an EKG. This guy's QTC was like in the 560s. Is that good or bad? Not great, right? 440 is typically what you consider to be a pretty normal QTC. This guy was hacking away a QTC of 560, putting him at risk for SODS, right? So now the doc has asked me, do I do, like, say, prophylactic magnesium? What do we do? Do I treat the tachycardia? No, just keep chill, give him benzos as he needs to for the anxiety, seizures that develops there. If he develops torsades, then what do I give him? Magnesium, right? So in those cases there's no role for prophylactic magnesium as long as it's normal in the first place. But so again, kind of interesting smorgasbord of cases I had there over a weekend. It's a lot of fun. That's pretty much it. So any other ideas, any other thoughts, questions? No? Okay, so I'll see you guys a couple more times this semester. I think twice for Clin Farm. You know, see me online. Again, I apologize if you really hate my ugly mug watching that on YouTube. Just let me know and I'll change that for next time. But I actually think it works out. I think it's supposed to kind of increase engagement if you actually see the talking head instead of just hearing me talk over a PowerPoint. I don't know, but just let me know what you guys think on your reviews. I'm sure you guys will be brutally honest. Emphasis on the brutal, but there we go. All right, if anything else, I will talk to you guys next time. Feel free, if in the meantime, till your next class, to come by. I think Dr. Obaye is going to be busy until 10, so if you want to come by my office and talk about research ideas, I will be there. Thanks a lot. I'll see you guys next time.